Today, we're here back with Dr. Mark Heisig, and he's been on the podcast previously to talk about exercise intolerance. Today, we are talking about what do you do when you get a concussion, if you have a new injury or you're in the acute stages or maybe a re-injury. How do you approach treating a concussion from the ground up? So thank you so much for coming back on, Dr. Heisig.
Yeah, thank you so much for having me. I was actually excited when you reached back out because I enjoyed our conversation last time, and I can tell your podcast has a good influence on people. So I was just honored to be asked back.
Oh, thank you. I'm so glad you were willing to come back on. So a big goal of the podcast is I've spent so many years struggling through brain injury. We were talking a little bit before we clicked record here, and just sharing, how I've recently found some different things that have helped. But when I had my first TBI in 2007, really the doctor told me to go home and rest and do nothing, and that I would be fine in a couple weeks. And 6 weeks came and went, and I got worse. So, what I was told to do initially actually, I think, exacerbated and made my symptoms worse. And so I don't want anyone to suffer and go through, the wrong treatment for brain injury. And so I asked Dr. Mark to come on here to share what are the new concussion protocols, what's some of the new research, and what should somebody do when they get injured?
Yeah, absolutely. It's not uncommon, even today in 2022, to hear folks being told that they were told to rest. I think it got taken down recently, and I don't know if it's because I criticized it or not, but there was a local concussion clinic out here that had a video where one of their providers was basically saying, we tell our parents to treat their kids like mushrooms, to go hide, in the ground in a dark, quiet space. And what we're finding now through multiple consensus papers is that's just not the case. We don't. Strict rest, for a multitude of reasons, can actually worsen and prolong symptoms. So it's unfortunate that you heard that I heard that when I was a hockey player, and that kids and adults are still hearing that today.
Yeah. Can you share a little bit of your experience with concussion? Because you just mentioned as a hockey player.
Yeah, so I was a very active little kid. I started playing hockey when I was 8 or 9 years old. And I played for 13 years. So I played through college. I played in the ACHA. So I wasn't a stud. I wasn't NCAA on scholarship or anything, but I played high enough. But I was always the smallest guy on every rink after about my junior year of high school. And so I took big hits pretty consistently. And then in the kind of the course from high school to college, sustained 3 concussions. And they were, so at the time we didn't have the recommendations that we do now. At the time, it was still, hey, you should rest. We didn't quite know about substantive aerobic exercise. We didn't know about the things that we're doing now. So there was one hit where I remember I got on the bench. My coach rubbed my shoulders, said, "How you doing?" And my disorientation was kind of going away. And I go, "I'm good." And I went out and played the rest of the game. And retrospectively, would definitely never do that again. There was another game where I was rushing. If anyone in the listening played hockey, I was rushing to wave off an icing. I was trying to beat the defenseman to the puck so that we didn't have to take a face off in our zone again. And I was probably 8 feet from the boards. And back in college, I could skate somewhere a little over 20 miles an hour, kind of towards the boards. And this guy cross-checks me, so he hits me with a stick from behind. And I flew face first into the boards. If I didn't have a cage on, I definitely would have broken my maxillary bone, lost some teeth, broken my nose for sure. I black out, I go down. I feel like it's like a long blink. But I came back up, and when I came back up, I was still fighting for the puck. There's no puck. There's no players. I'm the only person on this side of the rink. The play is already 200 feet away from me. And I go, pardon my language. I was like, oh shit, I should get to the bench. And I started skating the wrong way to the bench, and had to go the other way. Our team is yelling at the refs because there's no penalty. There's no call. Same thing. Coach rubbed my shoulders. I sat a shift, so I didn't go out with my line the next shift. And then I skated again. And after that was tons of headaches, tons of anxiety, insomnia. I thought I was just dehydrated because I was always training and still playing and still practicing. But that took months for the headaches to go away. And I don't think I really fixed the insomnia and anxiety stuff until 5 years after I quit playing. So it was a lot of just like, I don't know what's happening, because I never even correlated it with concussion until I was in school. So it was really poor management of my own concussions. And so now seeing athletes and seeing what's happening in the NFL and different things, I'm like, God, we could help these people so much sooner.
So you work with a lot of sports concussions?
I wouldn't say it's the bulk of my practice, because a lot of folks are shuttled to different major hospital systems with their teams first. But I usually find the athletes that kind of fell through the cracks, or people that just kind of know of me word of mouth, where I'm seeing football, hockey, soccer, some cheerleading, are kind of the main sports that I see.
Okay. So do you see a lot of people that are in the acute stages of their concussion?
Yeah, I wish I saw more, which sounds bad, but I wish I saw more, because the sooner we see you, the less likely you are to deal with post-concussion. And we actually have it down to like some of the research, we have it down to like the day. Like we know, I'm not just saying that out of like arrogance or pride. Like we know that if you see a concussion literate provider, within the first week, you can literally save 2 to 3 months off your recovery time.
Which is incredible to hear when I'm sitting here like over 10 years of struggle. It's like crazy what's changed.
There was a study where we looked at kids, and they were seeing kind of the average time that they were seen versus their average kind of return to play recovery time. And what we saw is that on average, the kids who were seen about 4 days after their injury recovered in about 3 weeks. If you were seen 8 days, so just 4 days after your injury, if you were seen 8 days, you recovered in about 2 months. And so that's literally a 5-6 week difference. I think it was a 57-day difference between the folks who were seen in 4 days versus the folks who were seen in 8 days. And so then we have other studies where if you were seen kind of within 2 weeks, 2 to 4 weeks, or after 4 weeks, after 28 days, how do you recover? And that difference is almost a month versus 110 days. So it's almost a month to almost 3 months that you're recovering from, just based on when you saw someone who understands concussion. So it's like the sooner the better. So I wish my practice was all acute concussion, because it means I'm not seeing post-concussion. And not because I don't want to help post-concussion, but ideally we're just minimizing that from
you don't want people to have it. Yeah.
Yeah. Exactly.
We don't want people to get to the point where they're, dealing with symptoms months, years down the line. Yeah.
Yeah. And I think what happens is, because we also have, this isn't to badmouth providers, it's not, we have research that a lot of providers, MDs, DOs, MPs, just aren't educated in concussion. And so you get this recommendation to rest because we've got this epidemiology data where we look back, like over 2 years, like how long did it take these people to recover? And we know that 70 to 80% of people are going to recover in 4 weeks. And so what's not accounted for is when you look at that recovery, it's like, well, recovery includes not only symptoms, but exercise tolerance and normal neurological exam and this stuff that requires rehab. But I think people hear that who aren't kind of in the concussion space and go, oh, well, like, I don't know, most of my patients are going to recover in 4 weeks anyway. So just, go do your thing, go rest, go wait.
So why do you think it is that people who see a concussion literate doctor within 4 days might or statistically recover quicker than even 8 days? Like what is different about when you see a concussion provider? What kind of tools can they give you? Why is it so drastically different?
Yeah. So ultimately, so that like in an ideal world, I'm seeing you 1 to 2 days after your injury, because we're ruling out something that's not concussion. It could be something more severe concussion, or just confirming that it's concussion. And then I believe this research is out of Canada, but just even being able to explain to you your injury, just being able to say, hey, I know you can't see it, but I know you can feel it. This is what we think happened to your brain. We think your brain stretched and shook and moved around, but it didn't tear and it didn't bruise. That's why you're not seeing anything on CT. But when it stretched, electrolytes went everywhere and you had to put those back. It's like you spilled glitter. It's a pain in the ass to clean up the glitter, but it takes some energy and you got to do that. And as you use that energy, your energy levels in your brain dip. And so you started to feel worse. And that's kind of where you're at today. It's like you feel worse than your injury when you originally got injured, but it's going to get better. Like it takes about 3 weeks for your brain energy metabolism to return to normal. And in that time, we're going to look for visual deficits, vestibular deficits, cervical spine deficits. Do you have normal autonomic exercise tolerance? And so that's where we're basically, that first visit is just screening and just saying, do you even have a concussion or do you have something else? And kind of a big sweeping view of this is what rehab over the next 2 to 3 weeks is going to look like. And so just even setting you up with a plan, giving you the confidence to know that you can recover, is I wouldn't say it's half the battle, because you still got to recover, but it's a big confidence boost to know, okay, this person knows what's happening, and they have an A to B to C to D kind of plan for how we're going to move forward. And if A, B, and C don't work, we know the specialists we're going to refer to.
Yeah, that's so good. So it's about setting up a plan.
Yeah, exactly.
Yeah.
I would look for red flag symptoms to make sure I don't need imaging. And so those, if I want to read those, basically in the first 24 to 48 hours after concussion, if any of these symptoms are kind of appearing, you want to get imaging, because it might be something not concussion or in addition to the concussion. So if you're getting a really severe worsening headache, it's just getting worse and worse and worse, you're going to go get imaging. If you're the person you're with, or you're that person very drowsy or can't be woken, get imaging. Any seizure-like activity. So the fact that, like, if we saw Tua on the football field, the fact that he had that kind of decorticate posturing, that's seizure-like activity. He's getting imaging just for that alone. Decreasing level of consciousness more than 2 hours after the injury. So this person can't recognize people or places, or there's sort of this unusual kind of irritable drunk-like behavior. Imaging. Any vomiting, especially recurrent vomiting, any fluid or anything leaking from the ears, any bruising around the eyes or bruising around the ears, and an inability to remember more than 30 minutes before the injury. So what that looks like I had a patient who was longboarding down a hill, crashed, he hit his head, he knew he hit his head, but when he got up, he didn't know why his fiance was with him. He didn't know why his family was there. He didn't know that he was on vacation. And it took a while for it to all come back and be like, oh yeah, I was on vacation with my family longboarding. That was more than 30 minutes before the injury. We're going to send him for a CT just to make sure there's no bleeding, anything else.
Yeah, that's good. And probably most likely our listeners here that have gotten to this episode, they're probably not in the first week. They're probably in the first maybe a couple months, or I think the majority of my listeners have been living with post-concussive syndrome or persistent concussion symptoms. People say either, PCS, for a number of maybe months, years. That's the majority of, I think, my listeners, and because it's relatable to my story and to my life. But, let's say we have someone listening who had a concussion in the last 6 months. So what are some practical things that they can do to help themselves to improve?
Kind of just to repeat what we've been saying is the sooner you can get to a concussion specialist, the better. But in the meantime, so if you've been dealing with symptoms for several months or several weeks or whatever kind of the time frame is, most often what I find is that people have been, there's been kind of a fear or resistance around normal activity or normal movement, because it can provoke symptoms. You go for a walk and you get nauseous, or you unload the dishwasher and you get dizzy from the head movement. So you end up kind of becoming like a recluse and kind of like a hermit. And so one of the things you can do, or one of the best things you can do, is symptom limited activity. So kind of grading your exposure back to normal. So if you think about your symptoms, your overall condition on a scale from 0 to 10, I'm sure a lot of patients have seen that Likert scale where there's like the smiley face all the way to the frowny face. And so what we're thinking is find which face you're at. So maybe your symptoms are a little bit worse, but they're tolerable. You're like a 3. If you feel overall a 3, I want you to try to walk the dog, or I want you to try to unload the dishwasher. But if your symptoms get to like a 5, they move 2 points, we're going to slow down. If they move 3 points, we're going to stop. But what we want to do is we want to kind of push that envelope. We want to flirt with our symptoms a little bit to build that threshold, to build our tolerance back to normal activities while we're seeing a specialist for a rehab or whatever it may be.
So you mentioned symptom limited activity. So basically, you talked about this in the last episode you did with me when we talked about exercise intolerance. And that was actually a light bulb moment for me, because I had never really thought about that too much before. And so I had been putting into practice exercising underneath the threshold of when my symptoms started to go. And it's actually helped me a lot. And so, you don't want to push yourself so hard on whatever you're doing that it's like making your symptoms really, really bad all the time. And so, but what if somebody's sitting here going like, but anything I do makes my symptoms bad. Like what do you do when it's that severe?
Yeah, so I talk about the concept, if you don't mind me saying, I call it the bare ass minimums. And I got that from a kind of the nutrition coaching world where you find your BAM, your bare ass minimum. And it's, if you think about your activity on a dial from like, this is the minimum threshold to this is, I feel great and can do whatever I want. It's not an all or nothing throughout your day. And I talk about that with folks with their rehab. It's like, I don't care if you do everything perfectly. Like, let's just find something to kind of either maintain or push you forward. I just don't want you, for your own sake, I don't want you to slip back. And so I say, let's find your BAM. For a lot of folks, I say your BAM is to properly hydrate. You're going to drink 2 to 3 liters of water a day, because we know that when we take non-concussed people and we dehydrate them, they feel and perform concussed, particularly in cognitive domains and balance. Like when we run balance area scoring system, or when we ask them to go through the PCSS, they have cognitive symptoms, and they don't feel so great in terms of their stability. So we're going to hydrate.
So when you say hydrate, I've recently learned that doesn't mean just water. That means like some salt in your water or some electrolytes.
Yeah, some electrolytes, yeah.
Because I didn't know that for the longest time. I just thought if I just drink a whole bunch of water, then I'll be hydrated. But actually, hydration is more than just water.
Yeah, so water follows solute. So that's osmosis. So solute would be your salt. As salt gets absorbed into your body, water follows. So that's one of the ways we move fluid through compartments in our body is it's following gradients. What I will say is there's some folks who, when I say some folks, I mean, if we're eating a largely Western or largely processed diet, we're getting boatloads of salt in that. So just getting the number there is okay. If you're someone who's kind of refined your diet and you're eating kind of Mediterranean, paleo, keto, one of these kind of concussion beneficial diets, then I would say, yeah, like a scoop of electrolytes or some trace minerals kind of dropped into your water bottle. Like that's what I do is in my water bottle, I drop some trace minerals. And so I know for this 40 ounces or so, I've got some electrolytes in there. But yeah, so making sure that you are adequately hydrated is huge. And then after that, I'll say, can you breathe? And so we'll do 5-5 paced breathing is what I recommend for most people through the nose. So if you can see me, what it looks like, this is going to be really anticlimactic, but what it looks like is, and it's supposed to be that. So it looks like nothing happened.
Can you describe that to our audio listeners?
Yeah, actually. So what happened there is I was breathing through my nose, inhaling for a 5 count and then exhaling for a 5 count. And when you think about it, it's just a normal breath slowed down. So when I prescribe this to people, a lot of times what they'll do, and you'll be able to hear this because I got a deviated septum, is they'll go, and then they hold for like the last 2 seconds of the 5 count. And then they're like, and then they hold for the last 2 seconds of the 5 count on the exhale. And that's not what we want to do. We want a slow, normal breath. And when we do it through the nose, there's different things that happen in our brain through mechanical stimulation and kind of neurological activity. But when we do 5, 5, 5, 5, that ends up being 6 breaths per minute. And when we do that, we have the highest, for most people, we end up having a higher heart rate variability. So as you inhale, your heart rate should go up, and as you exhale, your heart rate should go down. And when we say a high heart rate variability, it means that inhale creates a higher heart rate and that exhale creates a lower heart rate. And there's a good range between that. So if we were tracking your heart rate real time, you're creating these nice sine waves. And what we see is if we hooked you up with EEG, we would see you start to shift into more of like an alpha wave state, which is like a calm meditative. You're not just zenned out and kind of zonked out, but you're kind of in this light, calm. We see decreased anxiety, decreased depression, improved visual acuity, improved reaction time. So we see good things from that state. But also as kind of a side benefit that kind of, I call it the peanut butter and jelly with exercise, is that breathing slower like that for a lot of people builds up just enough CO2 that if you're new to this, it can provoke symptoms in and of itself. And so one of the things we see, I talked about in the exercise podcast with you, is we see an increased sensitivity to CO2 after concussion. And so part of what that does is it dilates blood vessels and it creates like an extra flow in your brain or in your head, which can sometimes feel like the pressure or the fog or the headache. And so what we're doing when we're slowing down our breathing is where there's a little bit of buildup of CO2, and we're improving our tolerance to that CO2 to regulate blood flow and regulate autonomics there. So if there's two things, like if we dial your BAM dial down to kind of the minimum, I say hydrate and spend 5 to 10 minutes throughout your day breathing. If you can do nothing else, you're going to regulate your autonomics, and you're going to make sure that you have enough volume to move blood and nutrition around.
That's great. So you said earlier when you mentioned, we were talking about hydration and salt, you mentioned some diets that are helpful for concussion. So what do you think the ideal nutrition for somebody who is sustained a concussion would look like?
Yeah, so in ideal would be after the concussion. So if we could go back in time to all of our concussions, I would do the same thing, is after the concussion, for the 2 to 4 weeks after your concussion, you're avoiding dairy, you're avoiding gluten, and you're avoiding alcohol. Now, I didn't drink in college, but I was born in Wisconsin. And so I ate a ton of dairy and cheese and milk and all that stuff. And now I literally to this day can't tolerate it. And that happened in college, maybe 3 months after my last season of hockey, where it was just this acute intolerance to dairy. So what we know is after concussion, your brain barrier gets a little bit leaky, that blood-brain barrier gets a little bit inflamed and leaky, and that actually moves its way down to the gut. And so within a few hours after a head injury, your gut barrier is actually also a little bit compromised and inflamed.
Is that why people get nauseous?
Could be, but it's more likely related to, the nausea is more likely related to like visual or autonomic things higher up. What this could be more related to is the persistent neuroinflammation we see that leads to PCS.
Okay.
So when we think about the post-concussion buckets, we've got like autonomic, metabolic, visual, vestibular, cervical, psychological. This could drive that metabolic bucket. So we've got this inflammatory marker in the gut called LPS, lipopolysaccharide. One exposure of LPS to the immune cells in your brain, the microglia, can prime those microglia for inflammation for the next 10 months. And so that's where, one exposure, lots of inflammation. That inflammation makes its way to the gut, goes back to the brain, goes back to the gut. And so if we don't kind of halt that with diet, supplementation, rehab, this can be kind of a causative factor. Or a causative factor, like kind of a flame that keeps burning that we don't really know to address, because why would your gut impact your brain? But we know that gut-brain axis is really important there. So I've got quite a few patients now who are dealing with IBS or SIBO type pictures, small intestinal bacterial overgrowth pictures after their concussion. And so that's actually what we're working on to help with their fatigue, their headaches, and their other stuff. It's not so much the neck and the eyes as it is, okay, here's what you're going to be eating for the next few weeks. So going back to the original question is, so we would want to minimize kind of those food intolerances in the beginning. After the fact, we're just looking at things that are going to relatively restrict calories a little bit, because we know that when we give mice different diets, the ones who can eat as much as they want and the ones who are restricted just a little bit, not like a weight loss diet or anything, but just restriction a little bit, they recover faster in mental and physical and kind of their domains that we measure in mice. So the way that we do that for most people is just increasing fruits and veggies, because those tend to be more nutrient dense and less calorie dense. So just by way of fruits and veggies, you end up eating a little bit fewer calories. That does cool things for your brain. And then we'll lost my train of thought there. But so we'll basically go with something that's a little more like calorie restrictive, but more nutrient dense. So we want like half of your plate to be fruits and veggies. We want some lean protein, some healthy fats. And when I say healthy fats, I mean not like fried, not refined. It's like the whole nut or kind of an unrefined oil or an avocado or something like that. And the three diets that kind of pop up there would be Mediterranean, paleo, or keto. And the Mediterranean is the one that I recommend most because it tends to be the most accessible for people to transition to. And it tends to be able to cross cultures, whereas paleo or keto tend to be so meat heavy that you're not going to really hit vegetarian cultures, or it's not as accessible socially if you're going out with folks as well.
Yeah, that's so good. And like reducing inflammation, you mentioned a couple times in passing, and that helps because you don't want your brain to be inflamed while you're trying to heal from a concussion.
Yeah, exactly. And there's some, so if we're talking about the acute stages, there's some folks who will say, hey, I don't want you to do anything metabolic for a couple of weeks because I want that inflammatory process to go to go through, meaning like you don't want to, like if you got a cut, you wouldn't want to inhibit all inflammation or that wound would never heal. And so in some respects, folks are worried about doing stuff too early. What I would say there is that a lot of stuff that we're going to do through diet or through nutritional supplements is not going to work fast enough or acute enough to actually halt that healing process. Yeah. And the research we have in animal studies and in kind of pilot studies tends to show no effect, which I think they're measuring the wrong things, or benefit. And so I haven't seen it go the other way where nutrition or supplementation actually halts the healing process.
Well, I'd be surprised if we had anyone listen to this within the first day of their concussion. You know, it takes a little while before they start looking online to find resources. So we probably aren't going to have people. I mean, at minimum, we might have somebody within the first couple of weeks because they're like, oh, what am I supposed to do? So I hope that they found this episode. So I don't think we're going to have anyone that's like in the first day. And if we do, great. Yeah, I'm glad you're here. But it might be a little overwhelming because, you know, you're just brand new to this. But what about for somebody who has had concussions in the past and then they have another concussion? So like a re-injury.
Yeah, so same game. So treat that concussion as if it's new because you're dealing with that same neurometabolic process. So if you're not already, avoiding gluten, dairy, alcohol for that time period, hydrating, breathing.
And you say for that time period, because sometimes people hear that and they think forever.
No. So for that acute time period being 2 to 4 weeks after the concussion. And then what I will say is like when we're looking at diet, so generally it's going to be Mediterranean, paleo, keto for someone several months out, several years out even. What we can do then after that is look for actual food intolerances and digestive sufficiency.
Yeah, because it's different for everyone.
Yeah, so we'll look at, and this is controversial. I know if there's medical professionals listening to this, they're going to be like, that's bogus, but we can look at IgG food intolerances, which are different than IgE. So IgE is a food allergy, Ig emergency. IgG is IgG, like, God, I wish I could eat dairy. That's my like kind of way I differentiate it. And so what we'll look at there is IgG kind of takes hours to days to kind of rise. So you eat the food, it rises, but you can't correlate it with the symptoms because by the time it rose, you've already eaten that food over several days. So to trace it back, what was this is a lot harder than I ate shrimp and my throat started to close.
That makes sense. Yeah. So it's not like a immediate allergy response, but there's something in your body that isn't quite tolerating it.
Exactly. It's more of a slow burn. And so when we'll test this with folks, I let them know, hey, it's controversial. You're supposed to produce IgG to different foods. It's when you're producing off the charts amounts that we're going to look at it. It's when you're producing off the charts amounts that we might restrict it.
That's cool. You can test that.
From there, I'll even take it further and say, hey, we're going to look at if you're lighting up like a Christmas tree. And every food we test, there's tests where you can test 96 foods, 144, 200 and whatever, because you're testing food additives and spices and different things. If you're just off the charts on everything, I'm not going to have you restrict everything. That'd be silly. That's not healthy psychologically. Food is important for people. What that likely means is you're just not digesting food in general, or there's a global inflammation that's not related to the food. And so then we'll take it a different route. And that's a much more nuanced, like post-concussion, persistent concussion symptoms conversation. But when we're saying, hey, Mediterranean, paleo, keto, that's general. And then after that, if you've been eating that way and you're still dealing with gut issues, you're still dealing with the big one is like bloating and abdominal pain and that sort of thing. It's like, okay, well, then let's look at your digestive sufficiency, your food intolerances. Do you have a possible dysbiosis that we need to address? With a short course of antimicrobials, whether it's rifaximin or whether it's a botanical route, we kind of navigate that more specifically patient to patient.
That's great. I hope our listeners are paying attention to this. Hope you guys are paying attention, guys, because nutrition isn't always addressed by every practitioner, but find somebody like Dr. Heisig that is going to take a full picture look, because a concussion, if you can get anything from this episode, you got to take a full picture look at your recovery. And if you're able to address like nutrition and hydration and breathing and some of these, they seem so simple, but you could save yourself a lot of symptoms and pain for months to come if you're able to get your nutrition right. And so finding a concussion literate practitioner, meaning somebody who's up on current research, not just maybe any practitioner that's recommended by your PCP. You know, there are unfortunately still concussion practitioners that are practicing with old research from over 10 years ago. If a doctor tells you that all you can do is rest, that is your first sign to find a new one, because there is actually a lot you can do. And in my personal recovery, I've had so many different re-injuries over the years. It's hard. And for me, you know, we talk about nutrition, there was something in gluten that was affecting my brain. And we tried so many medications. And guys, when I tell you, this is like over 10 years of struggle. And now I've been gluten-free, and I don't plan to go back to eating gluten, because for me, that was the answer. But for others, you know, you might find that something else is going to help you. And so it's really important to not give up and to keep searching, and to know like there are things you can do. Even something as simple as breathing through your nose for 10 minutes a day can help you to heal.
Mm-hmm. Yeah, absolutely. Absolutely.
All right. So if we were going to wrap it up and you were just going to say, all right, to summarize, I just had a concussion. Now what? What would you say to somebody?
I would look for red flag symptoms to make sure I don't need imaging. Someone else is looking out for me for those symptoms to make sure I don't need imaging. I'm taking it easy, kind of minimizing screen time for the first day or so. And then as soon as that's over, I'm starting to move within my symptom limited threshold. I'm reaching out to a concussion provider to get some assessment and testing. I'm breathing, I'm hydrating, and I'm avoiding dairy, gluten, and alcohol for that kind of period of time.
Okay.
And that's kind of the crash course. And like initially minimizing symptoms, minimizing, threatening other conditions, and then setting up your care moving forward.
And then we talked about symptom limited activity.
Yeah, that is starting by day 3 at least.
Okay.
So those first 2 days, and it's going to be hard. You're going to be tired. Around days 3 to 5 is when your energy levels are at their lowest after that injury. But that's when you want to start like, okay, I'm going to take the dog out, or I'm going to read a little bit of this book, even if it's one page, or I'm going to do stuff to slowly integrate back into normal activities. I'm going to flirt with my symptoms until they start to go away. And we see that folks who do that, usually it's young kids that are kind of ignoring their doctors. But when we see that, it's usually around the 5 to 10 day mark that symptoms will then start to fade. Symptoms will then start to go away. And if they're not disappearing at that point and you're with a concussion specialist, that's when we look at those symptoms, we look at your exam and say, okay, here's the rehab that needs to happen.
Yeah, that's so good. A couple of weeks ago, or a couple of months ago at this point, I had a girl named Maddie on my podcast. It was... the episode's called Finding Yourself Again After TBI. And she talks about how her doctors told her that she shouldn't do anything, and she's an artist and she likes to paint. And they told her not even to paint, that she shouldn't do anything for like weeks and weeks after her injury. And I want to say even months. And so like she would go to physical therapy and then she'd be like, oh, I was painting at home. And so she said, in the episode, she said, I just ignored the doctors because I felt better when I painted. And, that's when I started to improve. And I just was listening to that story and I was like, oh my gosh, it's so hard, because here you have like a team of doctors that you're supposed to be able to trust telling you to do nothing. And she's like, I can't do nothing. Like, I'm going crazy. And to her, like, painting was what helped her. And so, I was so glad to hear that she did that, but it also at the same time kind of broke my heart, because I was like, painting is a wonderful thing to do after a concussion. Like doing something creative, that's probably the best thing you can do for yourself at home.
Yeah, it's a very low threshold activity. I mean, there's going to be some cognitive demand and blood flow, but again, if you start to feel 2-point increase, slow down on the painting.
Yeah. Like, you're not supposed to hate your life and not be able to do anything that you care about after a concussion. Like, do what you love, but under your symptoms.
There's a very logical, like any human in the world kind of living today would understand it, as a proposed mechanism as to why prolonged rest worsens symptoms. And it's like, you have the initial injury, doctor prescribes rest. We know that symptoms worsen in animal and human data, and we know that causes anxiety and depression and just kind of stress from being like, well, I can't do anything. I can't see my friends. I can't do. So then you go back to the doctor and they ask how your symptoms are, and they're a little worse. I'm feeling anxious and I'm feeling depressed. Oh, well, you should rest. And then you feel anxious, symptoms get worse. Oh, well, you should rest. And you're kind of stuck in this loop until someone goes, no, hey, let's do some symptom limited activity. Let's do some things that you enjoy, but within a threshold that you can tolerate.
Yeah. And being able to recognize when you start to feel off and when you need to stop, that's probably the hardest part, I think, having that self-awareness or trusting like a trusted person with you that, oh, you're starting, it's time to go, like, or it's time to rest at this point. It doesn't mean you're not supposed to rest at all, but it's just only rest is probably not the best way. And also not to confuse rest with sleep, because we need good sleep at night.
Yeah. Circadian rhythm is huge for a lot of people. I had one girl symptoms for a few years. I think it was coming up on the third year. So she's had it for 2 years, coming up on the third year, and it's headache and it's anxiety and it's all, kind of the classic picture. And for her, I was like, okay, let's negotiate here. She's a young college student. I was like, let's negotiate on a wake up time. I'd like it to be before 10 a.m., but I don't care if it's, I just need you to be consistent with it. She's like, I can do 9 a.m. because I got to be to class and this. And I was like, okay, let's do 9 a.m. From 9 a.m., you're going to step outside. You're going to, just get some sunlight in. You're going to sip your tea. You're going to do whatever. If you can tolerate it, walk to class outside and, get sunlight in your eyes. And then at night in your dorm after sunset, we're just going to dim the lights. 3 days of that, and headaches were gone. Anxiety was improved. And she's like, I feel like a new person. And it's because she was actually getting restorative sleep. Wow. Her circadian rhythm was starting to sync up and she was actually getting restorative sleep.
Yeah. I've heard that sunlight and bright light in the morning helps you to sleep better at night.
Yep. Yeah, it's called low solar angle light. So kind of the early morning light has the right mix of colors to basically, when it hits your eyes, it hits specific cells in the back of your eyes. They detect light independent of vision. So your eyes could be closed. If you flip that light on, those cells stimulate because they can tell a difference in light.
Wow. And
they go back, talk to the brainstem, talk to the hypothalamus in different areas to kick off a cascade of, okay, let's raise body temperature. Let's get thyroid hormone doing this. Let's get this doing this. Let's kick off daytime activities. And same thing. So low solar angle light in the morning kicks that off, and low solar angle light in the evening, kind of that sunset, also kicks that off. It acts as like timestamps to say daytime, nighttime, and your body kind of syncs up to that.
Yeah. And so when you say dim the lights at night, that means not being crazy on your phones or watching TV or having so much blue light late at night. Put on the podcast and listen maybe, but don't look at your screen too much.
Yeah, even further than that is it's not so much the color as it is the brightness, as it is the intensity of the stimulus. So I use flux and I use kind of those different things, but it's like I'll also dim as low as I can still see if I need to be on when it's dark out.
Yeah. My doctor recommended that as well because I am working on balancing my hormones and, getting metabolically healthy, and it's a big part of my recovery. And in this stage, that's what I'm focusing on. And so she's like, every morning, get some bright light in the morning and go outside. And at night, after the sun goes down, just dim your lights in your house. Like, don't have your lights on maximum bright. Like, don't sit at your computer and try and work at night. You're not going to be able to sleep. And since I stopped working at night, it's hard when you work from home or like I do things like this podcast, which is like, I just do it whenever I have time and when I can. So some weeks I'm like, oh, I have to get this done. And I've been really strict with myself about not working after dinner, and I'm sleeping so much better. It's amazing.
Yeah, it's awesome. It's awesome.
Yeah. All right. So are there any last words of hope and encouragement you would have for our listeners today?
I know the focus and a lot of what we talked about was in the acute stages, but just know that the treatment process is the same, whether you come in to me 48 hours after your injury or 48 months after your injury. We're turning over the same rocks. We're looking at the same things. And for the most part, we can get similar recovery trajectories. We have to look at different things. It might take a little bit longer, but we can still get you on the same path, whether it's acute or chronic. And so just knowing that there are options out there is, if that's enough to keep you going, I hope it does.
Wonderful. That's so encouraging. Thank you so much, Dr. Heisig. So how can people get in touch with you? Do you want to show your Instagram and your website and a little bit about your online program?
So my Instagram is just at Dr. Mark Heisig, DrMarkHeisig. So just at Dr. my name. My website is drheisig.com, drheisig.com. And then, I have a program that is still in the kind of the remodel phase. So I have like the first half of it built so that my daughter keeps me busy. But basically, it's an online program for patients it was really born out of the fact that I had a lot of folks from like Denmark and Germany and Sweden, and apparently there's not a lot of great care in kind of the Nordic regions in UK. So it was really born out of those folks, but also just folks in the US and North America that can't really access a concussion specialist. And so what this course is it's different milestones. So there's 8 different milestones that I have, and it's lessons and practical applications around milestone 1, 2, 3, 4. And if you sequentially go through this, you'll learn either how to treat your own recovery. It's not like a heady clinician course, but it's just very practical how to navigate your own recovery. And if the course applications don't help you, at the end of each milestone, I give you the specialist that you would reach out to if you're getting stuck. So the milestone 1 is just how to manage your symptoms so you can even do an online course. Because I realized that was a big problem for folks when I initially made it is, well, they're having symptoms just from even being on the course. So that first milestone is just how do you deal with screens and sounds and lights and things like that. That second milestone is going to be just understanding your injury. And then the third is building an exercise program. The fourth is building a plate. And we go step by step, building a plate as in building your nutrition plan. And we go step by step, head to toe, eyes to ears, metabolism, and to machine kind of through your concussion recovery. And again, at each step of the way, if something's not clicking or something's not jiving, I recommend which specialist to kind of seek out in your area. And then along with that, I will be starting weekly live Q&As. So if you're a member of the course, you can come in for an hour each week and we can just chat and troubleshoot and see how things are working or not working for you and what might be helpful to kind of point you in the right direction.
It's great. I love that this is available. Thank you so much, Dr. Heisig. It's been awesome having you here today, and I really appreciate you taking the time to share with everyone.
Yeah, awesome. Thank you for having me back. I appreciate it.
I'll put your contact information in the show notes so people can get in touch with you.
Awesome. Cool. Well, thank you.